Have you ever looked down and noticed that one of your testicles hangs lower than the other one? Maybe you're in the shower or changing clothes, and you start wondering if something's wrong. Is this normal? Should you be worried? Here's the deal: if you've noticed this, you're absolutely not alone. In fact, this is one of the most common things teenage guys wonder about but feel too awkward to ask. So today we're going to talk about why one testicle hangs lower, what's actually happening in your body, and when you should and shouldn't be concerned. My name is Sarah and I'm a health educator. Let's get into it. So first off, yes, it's completely normal for one testicle to hang lower than the other. In most guys, the left testicle hangs lower than the right one. This isn't some random quirk or a sign that something's wrong. It's actually a built-in feature of male anatomy, and there's a pretty practical reason for it. Here's what's happening. Your testicles are connected to your body by something called the spermatic cord. This cord contains blood vessels, nerves, and a tube called the vas deferens that carries sperm. Think of the spermatic cord kind of like a suspension cable that holds each testicle in place inside your scrotum. The thing is, these cords aren't exactly the same length on both sides. The left spermatic cord is usually a bit longer than the right one, which is why the left testicle typically hangs lower. It's just a natural variation in how your body is built. Now you might be wondering, why would your body be designed this way? Well, there's actually a pretty smart reason. If both of your testicles hung at exactly the same level, they'd be bumping into each other constantly when you walk, run, sit down, or move around. That would be uncomfortable and could potentially cause problems. By having them at slightly different heights, they can sort of nestle next to each other without colliding. It's like nature's way of making sure everything stays comfortable and protected down there. Another thing you might notice is that one testicle is slightly larger than the other. Again, this is totally normal. Usually the right testicle tends to be a tiny bit bigger. We're not talking about a huge difference here, maybe about half a teaspoon of volume difference. You probably wouldn't even notice unless you were really paying attention. Just like how your feet might be slightly different sizes or one hand might be a little bigger than the other, it's just normal body asymmetry. Now let's talk about why your testicles are even outside your body in the first place, because understanding this will help you understand a lot of other things about how they work. Your testicles produce sperm, right? But here's the catch: sperm production needs to happen at a temperature that's slightly cooler than your normal body temperature. Specifically, your testicles need to be about 2 to 4 degrees Celsius cooler than the rest of your body. That's roughly 3 to 7 degrees Fahrenheit cooler. If they were inside your body cavity like most other organs, they'd be too hot, and sperm production wouldn't work properly. That's why they're hanging outside your body in the scrotum. The scrotum is basically a temperature regulation system. It's designed to keep your testicles at just the right temperature for healthy sperm production. The skin of the scrotum is thin, it doesn't have much fat underneath it, and it has sweat glands that help release heat. When you're hot, the scrotum relaxes and hangs lower, which increases the surface area and lets more heat escape. When you're cold, the muscles in the scrotum contract and pull your testicles up closer to your body to keep them warm. This happens automatically without you even thinking about it. It's pretty remarkable when you think about it. You've probably noticed this temperature regulation in action. If you've ever gone swimming in cold water or stepped outside on a freezing day, you might have noticed that your scrotum gets all tight and shriveled up. That's your body trying to conserve heat. On the other hand, if it's a hot day or you've just gotten out of a warm shower, everything hangs loose and relaxed. That's your body trying to cool things down. This is all completely normal and it happens to every guy. During puberty, which is probably where a lot of you are right now, you're going to notice a ton of changes happening with your testicles and the rest of your body. Your testicles are growing, your scrotum is developing, and all the internal structures are maturing. It's totally normal to become more aware of your body during this time and to notice things you never paid attention to before. The fact that you're noticing one testicle hangs lower is actually a good thing because it means you're paying attention to your body, and that's important. Here's something else that's worth knowing. The position of your testicles can also change depending on what you're doing. If you're lying down versus standing up, they might hang differently. If you're exercising or moving around a lot, the muscles in your scrotum might contract to keep everything secure. Even your mood and stress levels can affect how tight or relaxed your scrotum is because the sympathetic nervous system, which controls automatic body functions, also controls these muscles. So if you notice that your testicles seem to be at different heights at different times, that's completely normal too. Now, even though having one testicle hang lower is normal, there are some situations where you should talk to a doctor. I want to make sure you know what to watch out for, not to scare you, but because catching problems early is always a good thing. If you suddenly notice a big change in how your testicles are positioned, like if one suddenly hangs way higher than it used to, or if it feels like it's twisted, that could be a sign of something called testicular torsion. This is when the spermatic cord gets twisted, and it can cut off blood flow to the testicle. This is actually a medical emergency and needs to be treated right away. The main signs are sudden, severe pain and a testicle that's sitting higher than normal. If this happens, don't wait, tell a parent or guardian and get medical help immediately. You should also see a doctor if you notice any lumps, hard spots or bumps on your testicles. Most of the time these aren't cancer, but it's important to get them checked out just to be safe. Testicular cancer is rare in teenage guys, but it does happen, and it's most common in males between the ages of 15 and 35. The good news is that testicular cancer is highly treatable, especially when it's caught early. That's why it's important to know what's normal for your body. Speaking of knowing what's normal, let's talk about testicular self-exams. This might sound awkward, but it's actually a really simple thing you can do once a month to make sure everything's healthy. The best time to do a self-exam is during or right after a warm shower because the scrotum is relaxed and it's easier to feel everything. Here's how you do it. Gently roll each testicle between your fingers and thumb. You're feeling for anything that seems unusual, like a hard lump, a bump, or a change in texture. Your testicles should feel smooth and kind of firm but not rock hard. You'll probably feel a soft, tube-like structure on the back of each testicle. That's the epididymis and it's supposed to be there. It's where sperm is stored as it matures. Don't freak out if you feel that, it's completely normal. If you do a self-exam every month, you'll get familiar with what's normal for you, and that makes it way easier to notice if something changes. If you find anything unusual, don't panic, but do tell a parent or go see a doctor. Most lumps or changes are not cancer. They could be cysts, which are little fluid-filled sacs, or something called a varicocele, which is when the veins in your scrotum get enlarged. These things are usually not serious, but a doctor can check them out and let you know what's going on. Pain or discomfort is another thing you shouldn't ignore. Occasional mild discomfort is pretty normal, especially if you've been sitting in an awkward position or if you got hit in the groin area. But if you have persistent pain that doesn't go away, or if the pain is severe and comes on suddenly, that's something to get checked out. Same thing if you notice any swelling, redness, or if one testicle suddenly feels much heavier than the other. Let's also talk about some other totally normal things you might notice. Your scrotum might have little bumps on the skin. These are usually just hair follicles or tiny oil glands, and they're nothing to worry about. You might also notice that the skin of your scrotum is darker than the rest of your skin, and that's normal too. The scrotum naturally has more pigmentation. Some guys have a lot of wrinkles or folds in the scrotal skin, others have less. All of this is just normal variation. Another thing that sometimes worries guys is noticing veins on the scrotum. You can often see or feel veins through the thin skin, and that's totally normal. Your testicles need blood supply just like any other part of your body, so having visible veins is not a problem. However, if you notice a bunch of enlarged, twisty veins that feel like a bag of worms, that could be a varicocele, which I mentioned earlier. It's not dangerous, but it's worth mentioning to a doctor at your next checkup. Here's the thing, your body is going through a ton of changes during the teenage years, and a lot of these changes can feel confusing or even embarrassing to talk about. But the more you understand about how your body works, the less stressful it all becomes. Having one testicle hang lower than the other is just one of those things that's completely normal, even though nobody really talks about it. It's a natural part of male anatomy, and it serves a practical purpose. The key takeaway here is that asymmetry is normal. Different sizes, different heights, all of that is normal. What's not normal is sudden changes, severe pain, lumps, or anything that just feels really off. If you ever have concerns, it's always better to ask a doctor than to sit there worrying about it. Doctors see this stuff all the time, and there's nothing to be embarrassed about. They'd much rather you come in and ask a question than ignore something that might need attention. Your body is designed to function in certain ways, and part of growing up is learning what's normal for you and what's not. Paying attention to your body, doing regular self-exams, and being willing to speak up if something seems wrong are all part of taking care of your health. And trust me, every guy goes through these same questions and concerns. You're not alone in wondering about this stuff, even if it feels like nobody else is talking about it. So to sum it all up, yes, it's completely normal for one testicle to hang lower than the other, usually the left one. It's because of differences in the length of the spermatic cord, and it actually serves a purpose by preventing your testicles from bumping into each other. The position of your testicles can change based on temperature, activity level, and what your body is doing at any given moment. As long as you're not experiencing pain, sudden changes, or finding any unusual lumps, there's nothing to worry about. But if you ever do notice something that concerns you, don't hesitate to talk to a doctor. They're there to help, and catching any potential problems early is always the best approach. If you found this helpful and want more content about understanding your body and what's normal during puberty and the teenage years, go ahead and subscribe. I'm here to answer the questions that people don't always feel comfortable asking, because everyone deserves to understand their own body. Thanks for watching, and I'll see you in the next video.